Sarcopenia is a condition marked by the age-related loss of skeletal muscle mass and strength, affecting up to 16% of adults over 60, and nearly half of those with type 2 diabetes. Sarcopenia increases the risk of disability, frailty, and a lower quality of life. While much attention has been given to muscle mass loss during weight loss interventions, muscle strength decline is just as critical. In fact, reduced muscle strength can predict negative outcomes like falls and fractures even more than muscle mass alone. This makes understanding and monitoring muscle strength essential, especially in older adults managing obesity and diabetes. Glucagon like peptide 1, GLP-1 receptor agonists, along with gastric inhibitory polypeptide GIP agonists, are increasingly prescribed for obesity and type 2 diabetes. These medications can lead to significant weight loss, often 10% to 20% of baseline body weight within 6 to 12 months, and improve blood sugar control. However, about a quarter of this weight loss comes from lean soft tissue, raising concerns about the impact on muscle health. While these drugs are effective for metabolic conditions, their effects on muscle strength, especially in older adults, remain underexplored. Emerging research shows that muscle strength and muscle mass are not always directly linked. For example, some studies have found that even when lean soft tissue decreases during GLP-1 agonist treatment, hand grip strength remains stable. This suggests that losing muscle mass does not always mean losing muscle strength. However, the relationship is complex, and more research is needed to fully understand how these medications affect muscle function, especially over the long term. Short midterm clinical trials in adults with obesity have shown that GLP-1 agonists like semaglutide and liraglutide can lead to significant weight and lean tissue loss, but hand grip strength is often preserved. For example, a 26-week study found that patients lost nearly 10 kg of body weight and over 1.5 kg of lean tissue, yet their hand grip strength did not decline significantly. Similarly, a 24-week trial with liraglutide showed no meaningful difference in muscle strength compared to placebo, despite reductions in lean tissue. These findings suggest that muscle strength may be relatively protected in the short term. Combining GLP-1 agonists with exercise has also been studied. In young men with prediabetes and obesity, tirzepatide plus resistance and aerobic training did not provide additional muscle strength benefits compared to exercise alone. This suggests that, at least in younger adults, the addition of these medications may not enhance the effects of exercise on muscle strength. However, the duration of these studies is often short, and the findings may not apply to older adults who are at higher risk for sarcopenia. Longer-term and observational studies in older adults paint a more concerning picture. Research has shown that prolonged use of semaglutide in older adults with type 2 diabetes can lead to accelerated declines in hand grip strength and increased risk of sarcopenia. For example, one study found that after 12 months, older adults on semaglutide experienced greater reductions in muscle strength compared to those on other diabetes medication. These findings highlight the need for caution and close monitoring of muscle health in older patients using GLP-1 agonists. Muscle strength is more than just a number, it's closely tied to independence, daily functioning, and quality of life. In older adults, declining muscle strength can lead to falls, fractures, and loss of independence. That's why it's so important to track muscle strength, not just muscle mass, when evaluating the safety and effectiveness of weight loss medications like GLP-1 agonists. Ensuring that treatments do not compromise muscle function is essential for maintaining health and autonomy in aging populations. Several ongoing clinical trials are now focusing on the impact of GLP-1 and GIP/GLP-1 receptor agonists on muscle strength in older adults. These studies are designed to provide more definitive answers by including larger sample sizes, longer follow-up periods, and more comprehensive assessments of muscle function. The results will help guide clinicians in balancing the benefits of weight loss with the need to preserve muscle strength, especially in populations at risk for sarcopenia. Summary: while GLP-1 and GIP/GLP-1 receptor agonists are effective for weight loss and diabetes management, their long-term effects on muscle strength, especially in older adults, require careful consideration. Short-term studies suggest muscle strength may be preserved despite lean tissue loss, but longer-term data raise concerns about accelerated strength decline. Future research should prioritize muscle strength as a key outcome, ensuring that weight loss strategies do not inadvertently increase the risk of frailty or loss of independence in aging populations.